In exercise 10, we are now going to look at the appendicular skeleton. Remember, the appendicular skeleton is composed of those bones in the appendages, the arms and legs, as well as the connecting points to the axial skeleton. So basically, your shoulder and your hip. So the pelvic girdle and the shoulder girdle or pectoral girdle. Pectoral girdle is the shoulder. It is composed of the clavicle and the scapula. So it's attaching the upper appendicular skeleton to the axial skeleton. It's attaching the arm. It provides a lot of attachment sites for muscles. One thing that you will notice is that if you have a lot of flexibility, you tend to give up stability. So they kind of go inverse. It's a give and take type thing. So with the pectoral girdle, the shoulder joint, you have a lot of flexibility, you have a lot of range of motion, but you do give up the stability. In this anterior view, you can see the placement of the clavicle, often layman's terms call it the collarbone, and then the scapula, which once again layman's terms are the shoulder blade. But remember, you're an A&P, so you have to know the anatomical terms for these. This is showing the shoulder joint in more detail of the various ligaments that are holding the bones together. And then, like I said earlier, you're providing a lot of places for muscle attachment. That is also going to help keep that joint in the proper position that it needs to be in. With the upper arm, you have the humerus. Typically, when we talk about the arm, that is what we are referring to. And then the forearm is the lower arm, and the bones there are the radius and the ulna. In the hand, you're going to have the wrist, the palm and fingers, and the various bones that are associated with them. In the wrist, you have the carpals. There are 8 of those bones. In the palm of your hand, there are 5 metacarpals. And then the fingers, there are 14 phalanges. We look at the humerus. Once again, this is in the arm. And you have some of the major bone markings, as you can see, that are allowing for the bone to be positioned properly in the joint in that particular area. So here we have the greater tubercle, you've got the head, and then down here you have the epicondyles and the condyles and the fossa that are going to play a role in the joints with the radius and the ulna. Now, looking at the forearm, you have the ulna right here, the radius right here. Notice how they come together to form the joint with the elbow right here. So this would be the humerus. And then from the posterior side here. And then down at this end, they form the joint with the wrist. Once again, as you study these, learn some of these different bone markings as well. In the wrist, as I said, is composed of 8 bones. And yes, you do have to know them. They are roughly formed in 2 rows of 4. So you have a row of 4 right here and a row of 4 right here. The metacarpals are just labeled as metacarpal 1, 2, 3, and 4. You are starting with the thumb. So they're across here. And then the phalanges. Now the thumb is different. It only has 2 phalanges on it, so 1 and 2. But the other 4 fingers, you have 3 phalanges. And the names should make sense, that you have the proximal, the middle, and then the distal phalange. Once again, those location anatomical terms come into play here. So hopefully you're starting to see why I was really pushing that you understand those from exercise 1. The pelvic girdle is commonly what you know as the hip. It is composed of the sacrum and the coxal bones. The coxal bones are going to be the ilium, the ischium, and the pubis, which fuse together. So you notice in the back you've got the sacrum right here. This is this portion right in here. And then the coccyx. You can look at the pelvic girdle and determine if the individual, if you have skeletal remains, if it was female or male. Why? Because there are differences between them. The pelvic girdle on a female is wider. It tends to be shallower. It's lighter. It's more round. The coccyx is not as curved inward. And then the pelvic outlet is much larger. All of this is to help assist with carrying the developing fetus during pregnancy and then for delivery of the fetus for childbirth. So if we look at some of these differences, the female pelvic girdles, you can see this is known as the pubic arch. It's much wider than what a male is. You have a much wider birth canal area. And then if you look at the coccyx, this is a really neat picture that shows, see how right here on the male, the coccyx is more curved versus the female where it's not as curved, it's more straight down. Because of that, yes, it is true that women have a greater chance if they fall, if you fall and you land on your backside, because the female's coccyx, commonly referred to as your tailbone, is sticking more straight down, it's more exposed, you have a greater chance of breaking it than males do. It's going to be painful. Anytime you break any bone, it's going to be painful. Obviously, you can't exactly put a cast on it, and so what the recommendation usually is, they call it a donut. Just think of it like a circle inflatable ring that kids like to play with in a pool. Get one of those and sit on that, and that is going to help you until it recovers. But yes, it's true. Females have a greater chance, not because we're klutzier. Well, sometimes you might argue with certain individuals, but it's because of that coccyx being straight down, less curved than a male. We have a greater chance of breaking it. And why is it straight down? It allows for, you have more space here now for childbirth. Continuing on down to the lower limb is comprised of the thigh, which has the femur. You have the knee, which has the patella. The lower leg, which is the tibia and the fibular bones there. And then the foot, you have the ankle, which has the tarsal bones. There are 7 of them. In the foot, you have the metatarsals, of which there are 5. In the toes, you have the 14 phalanges. So as we move down with the femur, once again, this is the longest bone in the body. It is structurally made so that it can transfer weight straight down. It's not as good as getting a force coming at it from the side. So that's when it can break, is when it has these forces coming at it from the side, but it can withstand a lot of force coming straight down. So you notice it has a very defined neck and head right here that help to hold it into that pelvic girdle. You have less flexibility, but more stability then. The patella is a sesamoid bone. It is the kneecap. It is going to be embedded in the tendons of the muscles that are helping to form that whole knee joint itself. So the femur, anatomically, the femur is in the thigh, and then the leg is the lower portion of the leg below the knee. And that is where you have your tibia, right here, and then the fibula, which is right here. The fibula is the thinner bone. It's long, but it's thin as compared to the tibia. The tibia has to be thicker because it's transferring the weight down. The fibula is for muscle attachment, so it doesn't need the strength to transfer the weight down. And then you have, excuse me, the ankle, which has the 7 bones, the tarsal bones, which are shown right in this area. It does include the calcaneus, which is your heel bone, as you can see here. And then the metatarsals, which are across here, once again, they are numbered metatarsal 1 through 5, starting 1, which goes with the big toe. And then you've got the phalanges, once again, labeled as proximal, middle, and distal, according to their placement. So this is showing a little bit better with all the labeling of, once again, the tarsals, the calcaneus, the talus, the navicular, and then you have your medial, intermediate, and lateral cuneiform, and then the cuboid, metatarsals, and then phalanges. The foot also has arches. There's 3 different arches. As you can see, the anterior transverse arch is the one right here. The lateral longitudinal arch is right here. And then the medial longitudinal arch is this one right here. If you're flat-footed, that means the arches are not present. You can tell this by looking at your footprint. If you have a normal arches, it should look like this middle one right here. And then if you have high arches, your footprint would look like this, where you're not actually touching right here, the longitudinal ones as well.